What is Turner syndrome?
Turner syndrome is a chromosomal abnormality. It's actually one of the most common chromosomal abnormalities that we see.
How is Turner syndrome diagnosed?
Turner syndrome is diagnosed by sending a test, a blood test, that will look at the number of chromosomes that you have. You generally have the same number of chromosomes in every cell, but we generally look at 20 or so cells to make sure that there aren't some differences between them. And in Turner's, where as most people have either two X's or one X and one Y, in Turner's you will see an X and a blank or a piece of a chromosome but not a complete sex chromosome. So they have all their other chromosomes normal, just the sex chromosome. They're missing one copy of the X generally in what looks externally like a girl.
Can Turner syndrome be treated?
Turner syndrome itself cannot be treated because it's something that happens from the moment of conception when two cells come together and every other cell in the body is made just like that, generally. Where if for Turner's you would have an X and then either a piece of a chromosome or an absent chromosome in the sex chromosome category. You can't go back and put that piece back into every chromosome. But what Turner syndrome presents with, several different symptoms or traits, we certainly work with those.
Can Turner syndrome be diagnosed and treated in the womb?
So Turner syndrome certainly could be diagnosed in the womb. We often do blood sampling from the cord to be able to diagnose things like Down syndrome, and we could also diagnose Turner syndrome in the same way by running the chromosome test. However, since there's no treatment for it, by the time there's enough cells to make a baby that we would test, again, there's too many cells for us to be able to fix.
Do people with Turner syndrome have any type of learning disability?
They do sometimes. I would say while there are many chromosomal abnormalities that we see that cause profound intellectual disabilities, Turner syndrome is the one that stands out as normally having normal intelligence. However, in girls with Turner's, we specifically see some difficulties with mathematics.
What type of physical problems does Turner syndrome cause?
Well, there's a wide variety because, of course, it depends on how many cells you have that have Turner's collection of chromosomes. Many girls who have Turner's will have some outward characteristics that are pretty obvious. The first one is 95% of them are shorter than the average girl. Many of them have a slightly webbed or thickened neck and a low hairline. Some of them at birth will have some edema or swelling of their hands and feet. Some of them have been noted to have sort of a broad chest or even called a shield chest. They can have some abnormalities of their fingernails where they're slightly curved to make a U. And there can be some other skeletal abnormalities that we watch for, as well as osteoporosis later in life and some problems with fertility.
Is Turner syndrome inherited?
So technically not. You know, you think of something inherited as your mom has a gene for blue eyes and you got the gene for blue eyes and you have blue eyes. It would be rare for someone who had Turner syndrome to be able to pass that along to a child simply because it really does affect their ovaries, but it technically could. But most of the time, Turner syndrome occurs because of an accident of nature. When the two cells, the sperm and the egg, come together to make a zygote, that part of a chromosome is left off.
How common is Turner syndrome and how often do you treat patients with Turner syndrome?
I knew that you were going to ask me this question, and so I had to write down the number because I really didn't know the frequency. It happens about 1 in 2,000 live-born females. But what we want to remember is that unfortunately for some zygotes that are created, when there's chromosomal material missing, there may be also more chromosomal material missing, and that may lead to an abortion or a miscarriage because the baby's not viable. So probably about 15% of abortions were Turner's also, but that number of course is a guess since we're not able to study all of them.
Are women with Turner syndrome able to conceive?
They are able, and it does happen, and certainly we look at certain characteristics when girls have their hit puberty. If they develop secondary sex characteristics, then that makes us think more likely that they're going to be able to ovulate and support a pregnancy. So we never say never, but there are unfortunately high numbers of girls with Turner's who have a hard time getting pregnant.
And what is mosaic Turner syndrome?
right, so when you first get two cells coming together and you make that first zygote that has 23 pairs of chromosomes plus that X and then that blank, it is supposed to replicate multiple cells that look exactly like that, but for whatever reason, sometimes we end up with someone who has some cells that are XX and some cells that are X, we call it O, or X blank. And so that would be mosaic Turners. And depending on how many cells you test in a blood sample, you can get an idea for whether they are 50-50 mosaic or more 25-75 mosaic. And again, we think that that affects sometimes their presentation. I have had several patients who have presented to me later in life, and the only characteristic that was obvious about them was that they were short in stature.